In this video, let's discuss what happens during a vaginal examination. Hi, I'm Dr. Sylvia, a general practitioner and health educator with AskAwayHealth. First, what is a vaginal examination? It is simply the examination of the vagina and its nearby tissues by a healthcare practitioner. What are the reasons for a vaginal examination? There are many, but it could be to view the appearance of vagina for any changes to the normal, to get tissue samples, for example, during a smear or samples of a discharge. It could be to introduce a coil or remove a coil, to assess the stage of labor in which a woman is, and to assist in delivery. So there are several possible reasons for having a vaginal examination. Most ladies will have their first examination during a sexual screen for infections or if they're having a cervical smear. Procedure. So it's time for your vaginal examination. Most women do not require any special preparation. It's a reasonably brief procedure, and women report different degrees of pain, from a mild or moderate discomfort to a more significant type of pain. First, it's important for the health practitioner, whether it's a doctor or nurse who's doing the exam, to explain the procedure to you and to be sure that you understand why you're having it done. They should offer you a chaperone. That is a standard requirement for any intimate examination. You can choose whether to bring a friend along with you who will act as your chaperone, or if a staff member of the healthcare facility where you are can provide one for you. And next, the doctor or the nurse gets ready for the procedure. They will invite you to a couch that is screened off, where you can remove your inner and outer clothing on your bottom half and lie back. Most often in a standard vaginal examination, we don't need you to have your legs supported by strap, but sometimes in a more detailed test, for example in a transvaginal ultrasound scan, it may be necessary to have your legs up. While you're getting settled, the doctor or nurse is getting their gloves, a vaginal speculum, some lubricant gel, and a receiver dish that they might need to carry all the equipment that they need for the procedure. So the standard vaginal examination generally happens in two parts. Before touching you, the doctor inspects or takes a close look at the entrance of the vagina and the tissues around it. This includes the labia, and we're looking for any changes, for example, lumps or rashes, or discoloration from inflammation, for example. Next, a digital examination, or when the doctor inserts one or two gloved fingers into the vaginal canal. This should not be painful. When it's gently done, it allows the doctor to feel the walls of the vagina and also locate the cervix. The cervix is the first part of the womb, also known as the neck, and carries the entrance to the womb. In some of us, the cervix may be slightly tilted upwards, and in others, it may be in a different position known as retroverted. In both cases, it's a normal position for the cervix. At this point, your doctor can check if your cervix is freely moving, which it can do a little bit within the pelvis, and this is relevant, for example, in a condition like pelvic inflammatory disease, which if present may cause the cervix to be fixed or unable to move. Your doctor can also feel to the very end of the vagina where there's usually some free space that is normally empty, but if it appears full, or if touching your cervix causes pain, it may suggest problems like an infection, the presence of an enlarged cyst, or other abnormalities. Now that we have an idea of where your cervix is located, it's time to insert the vaginal speculum. Again, with gloved fingers, the doctor picks up an appropriately sized vaginal speculum. Yes, they come in various sizes, and applies some lubricant to the tip and the upper parts of the speculum. The speculum can look a little bit scary, especially when you've not had this procedure done before, and when you imagine having this instrument going inside your vagina. They're usually made of plastic, but not too long ago they were metallic, so you can imagine how uncomfortable it could be if a vaginal examination was being performed using metallic vaginal speculum in the hands of a healthcare practitioner who is not being gentle. I have a worrying feeling that perhaps they're still being used in some clinics somewhere in the world. So this is the vaginal speculum. At the front end, which enters the vagina, there is a blunt curved edge that can open up into two lips as it advances within the vagina. Now, don't forget, the vagina itself is a tube or a channel that has the cervix popping in at the far end. At the other end, you have the back of the speculum, which is the bit that usually remains in the hands of the doctor. This bit controls how wide the speculum opens, and it also carries a locking mechanism that keeps the speculum in place once you're happy with the view, and allows the doctor to carry out the test that they want to do. So using a speculum, the doctor can see quite a lot going on within the vagina and the cervix. And looking straight ahead through the speculum, the cervix is looking back at you. It can appear either as a circular object with a small hole in the middle in cases of a woman who's not delivered vaginally before, or with a slit across the middle if a woman has had a baby vaginally. It allows us to see if there is a discharge or unusual bleeding coming from the cervix. We can see tears or cuts to the vagina. We can see things like a polyp, which is similar to a skin tag, but this time is located on the cervix. We can also see any changes to the cervix. For example, an ectropion or other unusual appearances that suggest that we may need to do more tests on the cervix. So while the doctor can see all this, they can also do some tests. Now, to pass the speculum, it is usually applied gently into the vagina with the lips closed and in a vertical position, and while it's inserted, it's gently turned to the side so that it's horizontal as the lips open in the vaginal canal. We gently push it forward while trying to locate the cervix at the same time. Once the cervix has appeared, we can fix the speculum by locking it in place while we do the rest of the exam or whatever test that we're interested in. Once the examination or procedure is completed, it's time to withdraw the speculum. We will unlock it by turning the bolt in the opposite direction and then gently tugging at the speculum to pull it out of the vaginal canal. You might feel some discomfort while the speculum is being put in or withdrawn from the vagina. Still, if your clinician is gentle and explains things as they're going along, this shouldn't be too bad. Once the speculum is removed, you can relax your legs and tidy up. And that's the vaginal exam. Yes, I bet you didn't realize how much is involved in doing the vaginal exam. So now that you've learned about the vaginal exam, I'm sure you're interested in learning how the cervix works. So check out this video here. Let me know if you found this video useful in the comments section. Please like it and share. Don't forget to consider subscribing to the channel, and I will see you again soon.